welcome back to Wholeness and Wellness Counseling's On the Couch series. We're back today with Akilah Richardson, and we're talking about infertility being experienced by women and in many ways in which it impacts their lives and their emotional well-being. And so
one of the things that can happen is that you can begin to withdraw. We've seen that. We've seen women withdraw from their families, from their friends, not go to certain gatherings where children may be, just because they don't want to have to, one, be asked the question, or two, be exposed to babies, etc. A lot of newlyweds, who might know for sure that they're experiencing some challenges with infertility. The woman in particular, I feel uncomfortable being in spaces with family because she knows that question is coming. So when are you going to have your baby? And it can be deeply painful for her. Also anger. Sometimes a great deal of aggression and rage, that can be exhibited just because of what it does to you. The shame. We know what anger is, right? A secondary emotion. And under all of that is this shame.
you said it's a secondary emotion. So I want to let's talk about a secondary emotion, meaning there's some emotions that are easier for us to express and they actually hide primary emotion. So a primary emotion could be something like fear, but it's easier for us to express anger because expressing fear requires way more vulnerability and trust. Or we don't like fear in an open space. So we said anger is the secondary emotion that can be very explosive. And it's often and can manifest itself in aggression.
Most definitely.
So that may come up a lot.
Yep. For women in that particular case. I'm glad you mentioned fear, because I think sometimes if you're experiencing infertility, then you're afraid of finding out the reason why. And sometimes women can become immobilized. They don't want to go to access help. And I think in another segment we should discuss that. What are the options for women who may be experiencing these challenges? But because you suspect you may be up, you may be afraid of seeking the service of our own infertility clinics out there. And that's very, very real. Even if you have tried, sometimes you just stop trying because you're afraid of the disappointment month after month.
Yeah.
Because in one of my blogs, I actually spoke about what monthly menstruation does to you when you're trying to conceive. Every month is this trauma.
Every month there's a signal that you have failed.
Yes.
And we use that word fail because in society we think it's a success, it's accomplishment, something is wrong with you.
Exactly.
So every month, it's almost as though you're re-traumatized.
Every month.
You're doing this in silence. Yeah. So, it's clear this is having a tremendous impact on your well-being. How does it affect your relationship with families and your significant other?
I think sometimes, that's a very significant other. Sometimes if we're not sure where the problem lies, and I'm using that language deliberately because I don't want people to think we're saying the man is the problem, the woman is the problem. The problem may lie in some part of your anatomy, but we don't want to label the man as the problem, the woman as the problem. But sometimes you can begin to blame one another. So sometimes you begin to blame yourself or blame your husband. You don't know what's going on. So they blame and then sometimes we have cases where men, unfortunately blame women, and tell them you're the reason we can't conceive. It's your fault, etc., etc., leading to more shame and pain in the relationship.
So definitely detrimental impact. So we're going to close off this segment. When we speak again, we'll be talking about what can happen, what's your next step, what are some of the options, and how to process all of this and find your way forward. Thanks, Akilah. Thanks for joining us.